I now get to introduce two people. I am going to read the first intro because in the past hour alone, more than 3,000 new people started watching the live stream. So those numbers keep going up, which is fantastic. If you've ever wondered who's leading the charge on pain research and pain care in Canada, you're about to meet him. Dr. Hance Clarke is a clinician, researcher, advocate, and the voice behind some of the most innovative pain initiatives in this country. Today, he's teaming up with someone who brings vital, lived experience perspectives, and Dr. Hance Clarke is the president of the Canadian Pain Society. And with him, Graham Lord just finished his diploma in addictions and community support work, and he's stepping forward to be part of the solution. A key member of the CPS Local Organizing Committee, a sports lover, traveler, and someone with real lived experience navigating pain. Graham brings honesty, heart, and hope to this conversation. Please welcome Hance Clarke.
Right, so here we are. We are at the midpoint of the day. So this will be the last you will see of a stage, and we are at the midway point, and we will have the assembly and the parade out front, and we will walk proudly and show the world and the media who we are and why we're here. And so I really want you to understand that we started with the patient journey, and Graham is here because we are also going to end this portion of the day with the patient journey. I'm going to say a couple of words about Graham. He had a pretty horrific motor vehicle accident. He ended up with brachial plexus injury. Brachial plexus injury went on to leave him with a flaccid right arm, and he was a right-hand dominant individual. And so he had to retrain and relearn a lot of the things he knew at that point in time. Unfortunately, his path wasn't that straightforward. And he ended up in a scenario where we've talked about for the past decade, high-dose opioids, all of those issues. And he is now the person he is today, and I'm going to let you share your story, Graham, and I'll pick it up.
Thank you, Dr. Clarke. First, I'd like to thank Dr. Clarke for all the hard work it took for bringing this event together and all the hard work he does in improving people's lives. So give it up for Dr. Clarke, please. I'd also like to thank everyone here and everyone online watching this. And thirdly, I'd like to say living with chronic pain sucks. But I find it's a mindset. And it was with Dr. Clarke's help I was able to change mine. Getting off the opiates for me was massive. Before, I was a disabled person and my pain ruled me. Now, I'm a person with a disability and I rule my pain. I'm not going to let it beat me because it's beaten me for too long. I think there's a lot of keys to having a positive mindset, but for me, there's three things you must have: acceptance, hope, and a purpose in life. Acceptance. When you can have complete acceptance of your situation, whether it be chronic pain, mental illness, substance abuse, or even life, it fills you with a sense of determination you never thought you'd have. It's extremely difficult, believe me, I know. It took me 6 years to accept that my arm was gone. But that was the beginning of me not letting this define me. And when you realize that there's no other option to have but to move forward. Life will do you a bad hand sometimes, and you just have to play the hand to the best of your ability, because you never know what the next card's gonna be. Which leads me to, which leads me to my next point, hope. Hope. You always need to have hope. Hope for something better, hope that something can be done, or hope that you can find a way to deal with the situation the best that you can. These days, I put my hope into God. I just recently converted and became a member of the Roman Catholic Church. But you don't have to believe in God to have hope. As I said, I just recently converted. So there was a time there when I didn't believe, but I still had hope. As fleeting as it was, I had hoped that my life would get better. And I stand here before you today, my life infinitely better than what it was before. I also had hope for a robotic arm, a hope for which I still have. So even when your situation seems hopeless, there's always something to hope for. And a purpose in life. And lastly, I believe you need to find your purpose in life. I believe we all have been put here for a reason. And a lot of us don't know what that reason is. We all have skills, talents, and personal characteristics that can benefit society, the workforce, and each other. And I think you need to find what you're good at and what you like to do and try and combine them together. You must actively search for it. It will not come to you. And when you have the purpose, you will find you have focus, drive, and determination at a level you never thought you would have. I believe my purpose was guided to me spiritually, and that I have been put here to help people who are going through what I went through, not experience it to the level that I did. And that's what I intend to do. So in summary, I'd like to say that living with chronic pain is a journey. It's going to have its ups and downs, good days and bad days. But if you can maintain a positive mindset and attain these three aspects and work on yourself, then it becomes more of a challenge instead of a chore. Thank you.
And so I'm going to give you a little bit more context about Graham. And so when Graham came to see me, it would have been quite a long time ago now, he was in a rough spot. And I promised him, I said, well, he promised me, he said, if you can help me get there, will you play a round of golf with me, Doc? Left-handed round of golf. And we've played that round of golf, but more importantly, Graham has just graduated and is now going to be an addictions and pain counselor in the future. And so we're here because of Graham, because of Vina, because of Virginia, because of all of our patients and Pain Canada, who supports all of our patients in this country. And I'll tell you, this was published this morning. The QR code is there. It's now online. And I want you to see what that says. A pain funding gap and a database analysis of pain research funding over the past 15 years. And I want you to look at that red square and those red bars. That's the level of pain funding our community gets. And I know this is controversial, and people will not like me, and I've never been afraid to talk about these things, so you can put my poster up there, that this needs to change. And there are structures in place that are obviously need to be readjusted so that we can change some of those numbers and those metrics. And so, because that's really abstract, let's look at what those numbers look like. $12 billion of funding has been given out by our federal government, of which $256 million has gone into pain-related projects. CIHR has handed out $760 million, of which $16 million has made it into the pain community. It's a problem for 20% of our population. It is now a disease, and fair enough, it was not a disease before. So we were where we had to be because we were a symptom of something. But now we are rightfully in the place of being a disease that needs to be taken at the level. Does everybody know who the Canadian Cancer Society is? Does everybody know who the Canadian Blood Services are, and hemophilia, and all of these things? Those are household names. 1 in 5 households has someone living with pain in their household from some entity. And so this is why we are here, and this is why we are mobilizing today. I can tell you that we too have been doing some really cool work in the digital health space. Through some of our clinics, we can employ all of these questions and track them for quite some time. And I can tell you that we just published a really cool paper. And if you collect the data and you collect it en masse, you can get to a place where you can start to intervene and see those folks that are not on the trajectory you want them to be. You can catch the Grahams at an earlier stage, not 12 years on his fentanyl patches and his high-dose opioids, which is where I met Graham. We can tell you, by picking up and looking at the data in 5 or 6 weeks, who needs that multi-D treatment, who needs the psychology piece, who needs the physio piece, who else we can go down the other treatment modalities and be more efficient at it. We want to always understand how we can help save the economics. Well, these are ways that we can move some of these things forward. What's power? Power is education. Power is in ensuring that you as a patient, and you heard Kate earlier today talk about what your rights are in that clinical encounter, in that clinical setting. And you take someone and you put them in an institution like a hospital, and that is the place of least power that they will ever stand in. And so the more we encourage and the more we educate and the more knowledge we give to our patients, the better off we're going to be. And this was a systematic review talking about that. Another QR code in terms of preoperative education materials that we've created for our patients. And so these are things that we continue to focus on. And I'm not going to spend too much more time because this was something we did in Canada, and we put this up as kind of the first elective prescription suggestions. And so we polled the entire surgical population at the University of Toronto, and we asked them, first of all, it was great, I'll share a story. So we asked the staff surgeons how familiar or how confident that you're prescribing pain medication after surgery. And we asked the residents and the trainees the exact same question: how confident are you at prescribing pain medications after surgery? The answer was, from the residents, we're good, we got it. The answer from the staff were, we don't know what we're doing. So you had a little bit of a disconnect there. And one of the, I remember I was in France at one point in time, and it was in the Euro Cup. It was in 2016, I think. And I had just met some graduates from the University of Calgary, new general surgeons. And I said, so guys, when you have some of these patients that have a pain issue and they're post-operative and you're struggling, what are you going to do? And I said, oh, we're just going to give them a whole bunch of opioids and hope for the best. I said, He said, you know who you're talking to? I said, there may be some other ways you could tackle this, maybe some programs and some interventions you may want to have, and maybe build a service called a transitional pain service, et cetera, no shameless plug, and help some of these folks after surgery. Nonetheless, Rachel Bosma, who was just on stage before me, has been given $1.2 million a month ago to disseminate this nationally. And in order to do that, we're going to have to mobilize not just our physicians, we're going to have to go after the colleges, we're going to have to go after individuals that will help us disseminate. And it was amazing during an opioid crisis, you couldn't even get a CPSO to enforce a 20-minute module for a physician. And so we have to really start to push some of those boundaries in terms of making these things happen. Pain Canada and some of the docs that have been on stage today have created a module that any Canadian can take going into surgery. How many of you seen it? That's a lot of hands. 4, 5. At the end of this dissemination grant and the $1.2 million, I'm going to hope that at least 30 to 40%, and that's a big goal, of every individual that is going to have surgery in Canada will have knowledge that this exists. Because you don't want to be that patient or have your family or your loved one be that patient who stands in that clinic in front of one of us and says, I never knew this was a possibility. And again, that education is power. It is never, you would have not had that intervention from a life-saving perspective. You would have never taken that tumor out. You'd have never had that vascular repair of your aortic aneurysm, but you would have been better prepared for what that journey looks like after, if you are that 15%. And so again, I want to say we are here for our patients, and this parade is for our patients.